Welcome back to Brighter Morning with Bo on MCTV. Thank you for watching. We're glad to have you on. Our numbers to call are 609-6283, 609-6284. You can call and make your comment or ask a question. We'd be happy to talk to you. But right now, we have Dr. Nasser Mustapha, and we will talk with him this morning. How are you, Dr. Mustapha? How are you?
Good morning, Dr. Tiwari. Thank you very much for inviting me to your program.
Yeah, no, we're glad to have you. And I'm going to talk to you as both Vice President and long-standing President of TML, if you don't mind, and as a senior lecturer in sociology at the University of the West Indies. Is that okay? All right.
Sure, no problem.
So let me hear, first of all, what's happening to the community, what's happening to the Jamaats, etc. I mean, we had a tremendous lockdown. We were not able to go to prayers, namaz, etc. And we are opening up now. What's happening? What has happened to the community and the business of worship?
Well, first of all, I must say that all congregational activities were affected. We were not able to go to our annual pilgrimage for 2 consecutive years. We were not allowed to have our Friday congregational prayer, but people generally abided by the law. I think the congregation understood that it is for the greater good, that people gathering could lead to the spread of the COVID-19 and so on. So I think people accepted it, and we complied with the regulations. Funerals, for example, and other activities which were usually done by the Jamaat. This had a negative effect on people, especially the bereaved families and so on. But again, people understood and we adjusted accordingly. As the places of worship opened back recently, we have allowed people to come in limited numbers, and we observed all the protocols in terms of bringing your own prayer mat, washing, sanitizing, taking your temperature checks. And we also, at some of our mosques, we keep a register of people attending if we have to do any tracing later on. So I think that we have adjusted well. It has affected us, but I feel that people generally understood, the context of the restrictions, and we abided by the law.
Are you asking people to vaccinate?
Yes, of course. We encourage our members. Some mosques and schools were centers for administering the vaccine to members of the public. So I think that we encourage people to vaccinate. There are few people skeptical and expressing their reservations and so on. But that is a fact of life, and people need to look at the vaccine and the advantages that it brings, not only to you, the person, to be vaccinated, but to your family and to the community. I think that vaccine hesitancy is something that we expect. Historically, people have been skeptical about taking certain vaccines, but according to the statistics, according to the World Health Organization, for example, lives are saved. Millions of lives are saved every year by people taking various vaccines. So the COVID-19 vaccine, we know that there are different vaccines that are available, but generally we have to look at the benefits, right? There may be isolated cases of people having side effects, and we have to understand that. And I think we need to, as a member of the society, we need to look at the advantages versus the disadvantages. And there are a few isolated cases that have been circulating of people having negative side effects and so on. But they are statistically very significant, right? Studies have shown that in a sample, let's say in Los Angeles, where people who were not vaccinated, out of a sample of 44,000 people, people who were not vaccinated had 29 times more likelihood to end up in hospital. And similarly, the rate of hospitalization among vaccinated people was 1 in 100,000. The point I'm making is that when you are vaccinated, you are at great risk for contracting the illness and also ending up in hospital. So I think the advantages definitely outweigh the disadvantages.
Okay, well, we're glad that you would say that and you would encourage people in it because we think it's important. It's important for the country. But, you know, in all of this, as a sociologist, you've seen the behavior of people, the fact that some people want a vaccine. At one time, there was a vaccine anxiety when we didn't have when we didn't have enough vaccines. There was a lot of vaccine anxiety. People wanted to get the vaccines. And then when we got all of these vaccines, then the hesitancy started to kick in at about 400,000, earlier certainly than I expected. And then you had a lot of resistance in various quarters. How do you, sociologically, first of all, how do you explain this? And secondly, what is the impact of this, what can I say, contention between vaccinate and not to vaccinate?
Well, I think members of our society are affected or influenced strongly by social media. And of course, the isolated cases of negative side effects and so on would have circulated. And we do not verify, one, the credibility of the source and the statistical significance of how many people were affected as opposed to people who were vaccinated. So I think that our population generally tends to be influenced by what we read, what we see on social media, and we do not investigate and we do not listen. I mean, we are not healthcare professionals, but we need to take the advice of healthcare professionals and to understand that the purpose of the vaccine is to protect you and to protect others with whom you may come in contact with. So the greater good. Now, there were reservations about the AstraZeneca vaccine, for example, and the cause of blood clots. It has been shown that 4 in 1 million people, 4 in every million people who get blood clots. And whereas there are other things like the contraceptive pill, for example, that causes 1 in 1,000. So you have 1 in 1,000 being caused by the pill and 4 in 1 million being caused by the AstraZeneca vaccine. So when you look at cases even locally that would have been circulating and so on, we really have to look at it statistically. We have to put our trust in God. We have to take the vaccine with the intention of being cured and being protected. So I think the advantages, there might be disadvantages, but the advantages definitely outweigh the disadvantages.
You think that the COVID pandemic that people are experiencing, you think that has shaken the faith of some people, both in God and in religion? You think that has happened or not?
Well, what COVID-19 has brought, it came suddenly. We never expected it. 2 years ago, we never expected such a thing to happen. We believe that God has allowed that to happen, and we should see it as a wake-up call for us to realize that we are fragile, we are mortal beings, we are not here forever, and we have seen people that we know. All of us would see people that we know, friends, relatives, co-workers, who may have been very healthy. That is the thing, eh? We hear about people with comorbidities being more vulnerable, but there are very healthy people who may have contracted an infection by going somewhere or visiting someone or interacting with someone. So so people, when we look at that, we are reminded of the uncertainty of life, and the fact that we could be another another victim of the infection. So with that in mind, I feel it has brought people closer to God. People are no longer able to do, we're no longer able to do congregational worship, but people are praying more. When you see yourself in a precarious situation, you would try to get closer to God. And I feel that that is the effect on our community, not only our religion, but other religions in Trinidad and Tobago worldwide, that people have become closer to God, people are praying more, people are asking for help. So I see that as one of the positive outcomes. Also, it has brought families closer together because, with lockdown, we are at home, we are with our families. So the positive side is that we are able to spend more time. We know that nowadays, with both parents working, children being in school and so on, we have minimal interaction among family members. So it has helped to strengthen the bonds of the family. However, the negative side is where we have conflicts between family members, and it has led, as we know, to an increase in domestic violence,
Violence,
gender-based
yes.
violence, and that's one of the negative effects. But generally, it has brought families closer together.
Um, you say it has brought families, brought people closer to God, but you think in bringing these families closer together, you think what it has done is made parents reluctant to go to work and children reluctant to go to school?
Well, when you say reluctant, parents, I think they are grateful. Those of us who have jobs and who have a salary running during the pandemic were very fortunate. And parents have to consider themselves fortunate. We know that there are many people who did not report to work on a daily basis. Maybe they worked online, but they had a salary coming at the end of the month. And I think they are grateful for that. And children, they got accustomed to being at home, learning online and so on. But I think they look forward to going back and meeting their friends and so on. And so I think that, in terms of a negative effect, I don't see it really happened, but the people just understood that it was necessary. I don't know how the reopening of school will play out with people who are not vaccinated and so on. That is something to be addressed. But people are looking forward to going back, but they enjoyed the time at home, and we are very fortunate now to have mechanisms for communication among people in various jobs, in various professions, and so on. So, the society is running, things are happening, and social media has really contributed to our ability to interact with each other.
Beyond the issues of, let's say, remote work and online education, do you think that education and work, the whole business of working and education, you think this has to be rethought sociologically, do we need to rethink these things to get the value of education and the productivity of work?
Yeah. Well, generally, there are many things that could be done online. We see it happening with online banking. People used to go and stand up for hours in a line at the bank. Now you could do many transactions. You could pay your telephone bill, your electricity bill, your water bill, all your bills you can pay online, and you could transfer money. So I think we have the technology, the current technology allows us to adjust. Now we have to remember that this pandemic, when things open back, it will not be forgotten, and it's not only adjusting to the amenities that exist and the services that exist, but it is adjusting to life and the trials of life, and it will leave an effect because people have become more inward looking. People have become more isolated. We have to recognize that not everyone out there spoke about families being closer together, but not everyone belongs to a family unit. We have many single parents, single mothers, and so on. So apart from the economic effects, right, of not being employed, we have the social effects of isolation, of loneliness, of not having someone to talk to at the end of the day. So I think that the psychological effect on people who do not have supportive families so that somebody to talk to at the end of the day, someone that you could relate your concerns with, to discuss current affairs. Sometimes I feel that some people are affected more than others. You have to understand that some people are affected more.
Source of isolation. We've got a break here for a minute. We're going to take a short break. And when we come back, I'm going to ask you more about educational issues and some issues about sociology as a discipline. Okay?
Welcome to Lifetime Solutions, where you can trust your roof to us. Our services include custom fabrication, steel framing, roofing installation, on-site roll forming, roofing maintenance and services. Call 223-ROOF or 223-7663 for a quote today, or visit our website www.lifetimesolutions.tt.com. Lifetime Solutions. You can trust your roof to us. Call 223-ROOF or 223-7663 for a quote today, or visit our website www.lifetimesolutionstt.com.
Your house is more than just a home. It's the new normal. It's your place of work, your kids' school, and even your gym. It's where you and your family spend most of your time. With over 43 years in the building service industry, let Magic Mist Services Limited take care of your home cleaning and maintenance needs. From ceiling to floor, interior and exterior, allowing you to focus on what matters most to you. Give us a call. Magic Mist Services Limited, your total facilities management solutions provider.
Welcome back. This is Brighter Morning with Bo. I am Bo Tiwari, and we're so glad to have you on this morning. We're talking to Dr. Nasser Mustapha, and we're going to talk to him now about what's happening in education and what is happening to the discipline of sociology. So, Nasser, what about your teaching situation at UWI? Have you been able to adjust to that, and have your students been able to adjust to that kind of situation well?
I think that at the university, we have seen an increase, in training programs on the use of various platforms, Zoom, Blackboard, Collaborate, Microsoft Teams, and so on. So most of our staff are adequately equipped with the knowledge and skills to master online programs. It has been advocated for many, many years. Since you were the principal of UWI, we know that they were encouraging blended learning. We saw the opening up and the expansion of the open campus. But even us as regular members of staff, we were encouraged to have our courses through blended learning, that some people were able to access parts of our courses online. So it's nothing new. Learning has increased. And I certainly feel that there are many advantages to this, the lecturers and the students. However, there are disadvantages with certain disciplines where you are unable to, let's say some of our postgraduate students have difficulties in collecting data. We have the undergraduate students attending labs, going on field trips, and having hands-on experience. So in many fields, in many disciplines, people need to do practical work, whether it is in engineering, agriculture, medical sciences, and even in social work. People in social work, they have practicum and so on. So I think that some aspects of our learning have been affected, but generally, I think the students are enjoying it, and we have adjusted. We have adjusted accordingly. It might be difficult to get back to regular learning, but I think that based on the situation, the university is still on lockdown, all the offices and so on. But I think that we have adjusted very well. The Center for University Teaching and Learning has really got so many programs, so many webinars to help our staff, develop these skills.
What are some of the dominant concerns emerging in Trinidad and Tobago and the Caribbean region now? There were concerns before COVID. I think COVID has heightened the situation a little bit. What are some of those things?
Well, concerns with education generally, I must say that one, there is an absence of moral and ethical values being communicated through the education system. And we have to understand that education is not only about earning credentials, not only about getting a job, it is about shaping lives. And we have at all levels of the educational system, starting from the primary, the secondary, and the tertiary level. I think we have forgotten how education is supposed to mold lives, to shape lives, and to help people to prepare for the future. So we have not been very successful, because when we look at so many things happening in our society, so many people who have passed through our educational system and they still cannot make a positive contribution to society. So looking at getting a job, how do we judge secondary schools? By how many scholarships they get? How do we compare one school with another? This school got more scholarships than the other. And this is a way of, not even the primary school. The school, you judge a primary school by the number of people who pass for their first choice and so on. So I think we need to reevaluate the purpose of education. It is to shape lives, not only CXC passes, not only getting ones and so on, but it is having an all-round personality that you could be a positive positive person, a good parent, a good employee, and whatever that you may serve in, will certain, like honesty, sincerity, hard work, and so on, and conscientiousness. So I think that aspect of education is lacking, where people are not really, or educators, shouldn't only be concerned with the utilitarian objectives of education, but also in terms of the quality of our product, the quality of the students that we are producing over the years. And I think those could play a role. So the churches who have always been involved in the educational process. So the
Okay,
churches
so
and
you think in our time values are challenged then? Values are challenged.
Definitely. I think we want a person to learn about life, right? To learn about the challenges of life. We see so many sordid crimes, gruesome crimes taking place, where the perpetrators are young people, seemingly normal people, where the victims are innocent. And we see so many things happening because of some minor disagreement and so on. So I think that we want people to be conscious in their behavior. It's not only about policing, it's not only about laws and so on. It is about creating better human beings. The education system is the opportunity to do that. All right, we have the churches, but we also have the schools.
Tell me something. What are some of the dominant theories now in sociology that are important to appreciate and understand?
Yeah. Well, I think that we have in the United States we have critical race theory. We have certain dominant theories in Europe. People addressing some of the concerns. People addressing the relationship between nations and so on. But I think that we have tried in the Caribbean to analyze the Caribbean on its own terms.
Yes.
And we haven't really moved from beyond some of the earlier paradigms like plural society, Creole society, and plantation society. Those were the dominant paradigms in the Caribbean, but we haven't gone further. I think there is need to address, the Caribbean on its own terms, to look at our unique circumstances. Attempts have been done in the field of crime. And we know that many years ago, Price had argued for a Caribbean criminology, many decades ago, a Caribbean criminology, which is we cannot import theories to end crime in the Caribbean because of our unique circumstances. And this has been echoed many decades after by Bennett and Lynch, the need for a Caribbean criminology. So that is one example of an issue in the Caribbean that we need to develop our own Caribbean perspectives. Now, we also address issues affecting the Caribbean. And important issue is looking at race and ethnicity. Right, race and ethnicity, again, it varies. What exists in the United States, what exists in the UK, and what exists in the Caribbean, even between different Caribbean societies, is not the same. It's not the same. So we need to look at Trinidad and Tobago. The dynamic in Trinidad and Tobago is different to Barbados and Jamaica. Some of these societies are more class-based. Some of them are more stratified on the basis of race and color and so on. So we need to, look at our Caribbean societies, the uniqueness of Caribbean societies, look at our historical background, the impact of colonization, which we have not been able to really overcome. We have not been able to come to terms with the effects of colonization, of colonialism, let's say, in the educational system, right? So I think that there are many, many issues that we need to look at what is happening in the Caribbean and address them using sociology. Gives us the opportunity to look at society scientifically. That is the idea, to look at it scientifically. You know that people in different disciplines have their own biases and so on. The important thing is that we approach it objectively, dispassionately, and we are able to, as we spoke earlier about vaccine hesitancy, people need to look at that scientifically also, and to look
understand. Yeah. I mean, the important thing in all these research things and the theoretical formulations is really to make meaning of the life that we live and the societies that we have, not so? We've got to make meaning out of them, and that is important. I'm going to ask you a hard question as we close. You just have a minute to respond, because we are going to have to move to the news. But like in Trinidad and Tobago, we have a situation in which we have significant amount of poverty. So there's an inequality issue in Trinidad and Tobago. And this is not unique. The Western Hemisphere is the most unequal region in the entire world. So inequality is embedded in Western Hemisphere societies. The second thing is that in politics, we have the continuing factor of ethnicity and ethnic alignment with the political party system. So that is an issue. And the third issue is, in the economics, we have now had the 1% issue, which also has a racial connotation in seeing the structure of the economy in Trinidad and Tobago and the ownership of wealth. How are these things being addressed sociologically in terms of thought, in terms of ideas, in terms of theories, in terms of solutions for the society by sociologists like yourself, the department? Quickly, I remember you have a quick... that is a one-hour conversation, but...
I know. We have to understand that, people are really hurting out there. We do have, poverty affecting some people in a significant way. And we should not only look at handouts and immediate relief. That is needed, but we need a long-term solution to address people's needs. We need to capture, people's talents and help people to be more productive and to make a greater contribution to society. So I think bridging the gap, having a system for redistribution of wealth, and also helping our marginalized members of the population, give them the opportunity to contribute, give them the opportunity to work. So when people are unemployed, the society is deprived of their contribution, of their talent, and so on. So we have many talented people and who have the potential to be productive, who are not employed. So that's it, is to try to bridge the gap and also to have some system for the empowerment of people who are marginalized in our society. Thank you.
All right. I know that there's a lot more that you want to say and can say, but we have to close now for the news. I want to thank you, Dr. Mustapha, for being with me this morning. I'm really grateful, and we had a good conversation. And we move on now to Chanel Al-Siran for the news at 7.